Hi, it's Patrick Hutzel here again from Intensive Care Hotline, and this week I want to answer another question from one of our readers. And this week Marie from Melbourne in Australia writes in, and Marie writes, "Hi Patrick, my brother has been in intensive care for 13 weeks following septicemia following open heart surgery. He's 54 years old and had never been hospitalized before. The whole time he has been fed through an NG tube, he has a tracheostomy, being kept on a ventilator overnight, has had 18 surgeries. He was doing quite well, but after removal of the tracheostomy for a short time and failure after an hypoxic event has required re-intubation. He is understandably depressed, anxious, and has almost lost the desire to fight. We're trying to motivate him, have put together posters with inspirational quotes and family photos with messages of love. Do you have any suggestions of what else we can do? It's heartbreaking to see him so low. We understand why. Would love to hear any suggestions, ideas. Thank you." Hi Marie, thank you for your question. I'm very sorry to hear about the ordeal that your brother and your family are going through. Let's look at the positives first. Your brother has never been hospitalized and is quite young at the age of 54. The other positive is that he has a supportive family who's looking for options and is seeking out for help, and you are encouraging him. Keep doing that as a first step. It's almost unbelievable that he has had 18 surgeries within 13 weeks. Now let's look at the negatives and the things that very likely stand in the way of his recovery. It's a massive dilemma for every long-term patient in ICU and their families to have no or very little quality of life, which is leading to depression. The depression, on the other hand, often leads to the ventilator dependency and vice versa. It's a massive challenge and it's a vicious cycle. On top of that, there is the lack of privacy and the lack of dignity in ICU, and other people are running the show. You have already touched on what you and your family need to continue doing, such as motivating and inspiring him and the family photos. Other practical steps would be to look at continuity of care, such as having regular and experienced nursing staff looking after him. Some units have a tendency to let their junior staff or agency staff look after their long-term patients, as the more experienced staff tend to look after more acutely unwell patients. Secondly, make sure he's getting natural daylight, such as having visits outside as soon as his condition allows. Third, can he get a quiet room with natural daylight, or is he exposed in the middle of a busy unit and with no natural daylight? Fourth, making sure that the medical staff are on top of things. Again, some units have the tendency to almost neglect their long-term patients because the staff are getting frustrated as well. Ask the medical and nursing staff whether your loved one might be better off with antidepressants. No matter how difficult the situation, stay positive. Your brother will feel the positive vibes coming from you and your family. The longer your loved one stays in ICU, the higher the risk of him catching an infection. Therefore, a side room with no exposure to other patients and therefore bugs might be an advantage as well. As far as his tracheostomy goes, again, it's nothing unusual in intensive care to see patients having failed attempts to wean them off the ventilator and the tracheostomy for the reasons I mentioned. Depending on where you live, you might also consider external specialized services such as intensive care at home. There are services available in countries such as Germany, United States and Australia in Melbourne, who focus on weaning long-term ventilated patients in the home as a genuine alternative to long-term stay in intensive care, generally with a focus on quality of life for patients and their families. You can find more information at intensivecareathome.com.au. I have also sent you 3 more reports for you that we tend to send to our clients if they inquire about similar issues. The reports I sent to you are 6 answers to the 6 most frequently asked questions if your loved one requires ongoing mechanical ventilation with tracheostomy in intensive care. The next report I sent you is follow this proven system to avoid the 3 most dangerous mistakes you are making but you are unaware of if your loved one is a long-term ventilated patient with tracheostomy in intensive care. The next report I sent you is follow this proven 5-step process on how to be in control and influential if your loved one is a long-term patient in intensive care or is facing treatment limitations in intensive care. I hope that helps, and please let me know if you have any more questions. We also have more reports available, such as the 5 things you need to know if the medical team in intensive care wants to limit treatment, wants to withdraw treatment, or wants to issue a not for resuscitation order for your critically ill loved one. Now, if you have any questions, send your questions to support@intensivecarehotline.com and we can answer your question in this forum as well. If you haven't done so already, enter your name and email below and you get your free instant impact report so that you can learn instantly how you can improve your situation and what you need to do in order to take control of the situation, have real power and influence decision making. You get 4 other free reports if you enter your email. 6 questions you need to ask the most senior consultant in intensive care, the 7 most frequently asked questions whilst your loved one is critically ill in intensive care, 10 things you didn't know doctors and nurses are talking about while your loved one is critically ill in intensive care, and 9 myths of being a critically ill patient in intensive care. Thank you for watching. This is Patrick Hutzel from intensivecarehotline.com and I'll see you again next week in another update.